Welcome. If you are enrolled in the IGNOU MBA in Healthcare and Hospital Management, then MHHP-021 is the one course that finally turns your degree into a real finished thing. In this complete guide, we walk through the IGNOU MBAHCHM project from start to finish. What MHHP-021 really is, how to pick a practical topic, how to write and get your synopsis approved, the full report structure, submission, the Viva, and how it is evaluated. I am BK Sani, and on this channel we have guided IGNOU students since 2010. Let us begin. Here is the plan. First, we set the facts, what the MBA in Healthcare and Hospital Management is, and exactly where MHHP-021 sits. Then 5 common myths that get MHHP-021 projects rejected. After that, the full journey. Topic, synopsis, guide, data, the complete report structure, submission, Viva, and evaluation. We keep it tight and only about MHHP-021, so you can watch once and act. First, the program itself. The MBA in Healthcare and Hospital Management is run by the School of Health Sciences, SOHS. And that single fact matters because your project follows health science project practice, not the general management school. It is 112 credits across 4 semesters, English medium, and takes 2 to 4 years. To join, you need a bachelor's degree with 50%, 45% for reserved categories, and there is no entrance test. It is built for working healthcare people, doctors, nurses, pharmacists, paramedics, and graduates stepping into hospital administration. Now the project. The code is MHHP-021, and please lock that in. It is not the general MBA code. It carries 6 credits, which is roughly 180 hours of genuine student effort. It sits in semester 3 of the MBA in Healthcare and Hospital Management, and it is weighted at around 100 marks, so it moves your final result in a real way. Confirm the exact marks and the current word limit in your program guide before you start. Here is where most students get confused. So let us clear it once. The MBA in Healthcare and Hospital Management has 3 separate practical parts, and they are not the same thing. MHHP-021 is the project. A research report on a real hospital or healthcare problem? That is what this video is about. MHHL-020 is the practicum, a supervised posting in a hospital where you learn hands-on skills, and MHHT-022 is the internship, a roughly 3-month placement in a health organization in the final semester. 3 different things, 3 different codes. Do not merge them. So in one clean line, what is the IGNOU MHHP-021 project? It is the 6-credit research project of the MBA in Healthcare and Hospital Management, where you take one real problem inside a hospital or healthcare setting and apply management, quality, and operations thinking to it. Notice the word management. This is a management study set in a hospital, not a clinical or medical treatment project. You are studying how the system runs, not how a disease is cured. Why does this project even exist? It is testing 3 things at once. 1. Can you take the operations, quality, and policy theory from your courses and actually apply it to a live problem? 2. Can you do real research, clear objectives, honest data, sensible analysis? And 3. Can you read a hospital as a system and recommend something that a manager could genuinely act on? Keep those 3 in mind and every later decision becomes easier. A quick worry to settle before we go deeper. Is this degree valid? Yes. IGNOU is a central university. It is UGC recognized. This new MBA family is AICTE approved. And IGNOU holds NAACA AA+ accreditation. The degree is valid for private, public sector, and government roles. What actually sets you apart in an interview is the project you can talk about. which is exactly why doing MHHP-021 properly is worth it. Before the how-to, let us kill 5 myths. Each of these quietly gets projects delayed or rejected, and each one is easy to avoid once you have seen it. Myth 1. People assume MHHP-021 follows the general MBA project rules. It does not. This is a School of Health Sciences project and its code is MHHP-021, not MMPP-001. Take your instructions from your MBAHCHM program guide, not from a general MBA page. Myth 2. That the project, the practicum, and the internship are one submission. No. MHHP-021, MHHL-020, and MHHT-022 are 3 separate components with separate codes and separate deadlines. Myth 3. That there is an official MHHP-021 booklet online with a fixed word count. There is no widely circulated one. The figure you see everywhere, around 18,000 words, 50 to 60 pages, is the general MBA template that people borrow. Confirm your real scope in the MBAHCHM guide and with your guide. Myth 4. That a healthcare project must be clinical or medical. Number MHHP-021 is a management study, operations, quality, cost, patient experience set inside a hospital. And myth 5, the costly one, that once your guide signs the synopsis, you are approved. You are not. A guide signature is only step 1. Your project is valid only after IGNOU officially approves the synopsis. So never write the full report before that written approval arrives. Students who rush ahead often redo months of work when the topic gets changed. Patience at this stage saves an entire session. Let us hold those 5 together. Use the right code, MHHP-021. Remember the 3 separate parts. Do not trust a borrowed word count. Confirm it. Keep it a management study, not a clinical one. And always get official approval before writing. Clear those 5 and you have already dodged the most common ways students get sent back. Now the real work. Let us walk the whole MHHP-021 journey in order. The way you will actually live it. The journey has 7 stages. 1. Choose a practical health management topic. 2. Write the synopsis and get your guide sign-off. 3. Submit the synopsis and wait for official approval. 4. Collect and analyze your data. 5. Write the full report in the prescribed structure. 6. Submit it in the correct session window. And 7. Attend the Viva if you are called. The order matters. Approval always comes before you collect data. To make this concrete, we will carry one example through the whole video. The title is A Study of Outpatient Department. Waiting time and its effect on patient satisfaction at a 150-bed multi-specialty hospital in Nagpur. We will build this single MHHP-021 study end-to-end, so you see every stage on one real topic, rather than in the abstract. Look at why that title works, because the same logic applies to yours. It has a specific measure. Waiting time in minutes, a real number you can record. It has a reachable site. One hospital you can access with permission. It is clearly management, not clinical. It studies patient flow and satisfaction, not treatment, and its scope is honest. One outpatient department in one hospital, something you can finish inside a project. Compare that with a weak title, something like Healthcare Management in India. It sounds grand and it is unresearchable in a project. There is no defined site, no population you can reach, no indicator you can measure, and no data you can personally collect. A strong title names the place, names a measurable indicator, and stays inside one study area. A weak one stays vague and impressive. Evaluators can tell the difference instantly. If you are still hunting for a topic, here are the fields MHHP-021 naturally opens, outpatient and emergency patient flow, bed occupancy and length of stay, hospital quality accreditation and audits, patient satisfaction and grievance handling, pharmacy and inventory work, like an ABCVED analysis, infection control and patient safety, cost control and the revenue cycle, medical records and health information systems, staffing and human resources in a unit, and telemedicine and digital health adoption. Pick one lane you can genuinely reach. 2 filters before you commit. First, access. Choose a hospital or unit you can genuinely enter, through your job, your own city, or a contact who can introduce you. Access failure is the single biggest reason projects stall. Second, data. Make sure the data you need can actually be collected. Records you are allowed to see, or patients and staff who will answer. If the data is locked away, the topic is not ready, however good it sounds. You have a topic. Now the synopsis, the short proposal that decides whether you may begin. Get this right and everything after it is smoother. So what is the synopsis really? It is your project blueprint. A short document whose only job is to convince IGNOU that your topic is relevant to healthcare management, feasible in the time you have, and academically sound. It is written before you do the main work, so that months are not wasted on a topic that was never going to be approved. We keep the deep synopsis writing lesson for its own video and cross-link it. Here we cover the essential MHHP-021 view. What must the synopsis contain? A short specific title, an introduction and a clear need for the study, a review of relevant literature, your objectives, your research methodology and design, your sample, your tools and how you will collect data, expected outcomes and honest limitations, and references in APA style, along with your guide's signed biodata. It usually runs about 8 to 10 typed pages. Confirm the exact expectation with your guide. Let us write the objectives for our Nagpur example so you can copy the shape. Objective 1. To measure the average patient waiting time across OPD stages in the study hospital. Objective 2. To assess patient satisfaction linked to that waiting time. Objective 3. To identify the main bottlenecks and recommend practical improvements. Notice how each objective is measurable and tied to one hospital. That is what an approvable objective looks like. Here is the approval path. Step by step. Your guide reviews and signs the synopsis and their biodata. You submit it the way your regional center instructs. IGNOU reviews it for relevance and feasibility, and you receive official written approval. Only then do you start the full report. A guide signature begins the process. The university's written approval is what actually clears you to write. Why do synopses come back? 4 usual reasons. A vague topic with no defined site or measurable indicator, a topic that does not clearly fit healthcare management, missing guide proof, no signed biodata or signature, or copied content because a plagiarized proposal is refused outright. Fix those 4 before you submit, and your approval odds jump. A word on the guide because students underestimate this. Your guide should be a qualified academic counselor, a faculty member, or an experienced professional. Typically someone with a master's degree and around 5 years of relevant experience. For a hospital project, a senior administrator or a management faculty member is ideal, and their signed biodata must travel with your synopsis, or the proposal is simply not entertained. Choose someone who will actually read your drafts. Approval is in hand. Now the heart of the project, collecting data responsibly and building the report the way IGNOU expects. Where does your data come from? 2 sources. Primary data is what you gather yourself. Surveys, timing sheets, interviews, and direct observation inside the hospital. For our example, that is a stopwatch at each OPD stage and a short patient satisfaction questionnaire. Secondary data is what already exists. Hospital records, registers, quality reports, and published studies. Then you analyze it simply and honestly with clear tables, percentages, and charts. Clarity beats complexity every time. Now a rule that is easy to skip and dangerous to skip. Ethics. You are working with patients and staff, so permission and confidentiality are not optional. Get written permission from the hospital before you collect anything. Take informed consent from anyone you survey or interview. And never publish identifiable patient details. No names, no case numbers. A project that ignores consent can be rejected no matter how good the analysis is. Here is the part everyone wants. The exact structure of the report. Follow this order and your project reads like professional work. Before Chapter 1 come the preliminary pages, a title page with your details and the course code MHHP-021, a certificate from your guide confirming supervision and originality, your own declaration of original work, acknowledgements, and a table of contents with separate lists of your tables and figures. These pages carry small Roman numerals, not the regular chapter numbers. The body of the report is 5 chapters. Chapter 1, Introduction and the Need for the Study. Chapter 2, Your Review of Literature. Chapter 3, Research Methodology and Objectives. Chapter 4, Data Analysis and Interpretation. This is the core, where your tables and charts live. Chapter 5, Findings, Recommendations and Conclusion. After that, your references in APA style and annexures, your questionnaire, consent forms and raw tables. That 5-chapter skeleton is universal. The healthcare content inside it is yours. Let me flag the chapter that decides your marks. Chapter 4, Data Analysis and Interpretation. This is where evaluators look hardest, because it shows whether you actually did the work. For our Nagpur study, Chapter 4 would hold waiting time tables broken down by OPD stage, an overall patient satisfaction score, and a clear link between the two. Longer waits, lower satisfaction. Do not just show numbers, interpret them. Tell the reader what each table means. Across the whole report, evaluators reward 3 things: original work, your own data and your own words, because plagiarism is penalized hard. Logical flow, objectives, data and conclusions that clearly line up. And practical value, recommendations a real hospital manager could actually put into practice. If your conclusion answers the objectives you set in Chapter 3, you have a coherent project. The study is written. Now the mechanical steps that students lose easy marks on. Formatting, submitting, and the Viva. Formatting first. Type on APA4 size, in a clean, readable font, with 1.5 line spacing, proper margins, and page numbers throughout. References follow APA style. The commonly quoted length is about 50 to 60 double-space pages, but treat that as the general template and confirm the exact MHHP-021 figure in your program guide. We keep the full formatting rulebook for its own video and cross-link it, so this stays focused. When you submit, your pack must be complete, the approved synopsis or pro forma, your guide certificate and biodata, the full correctly formatted report, and your annexures, questionnaire, consent forms, and data tables. Assemble all of it into one clean, correctly ordered PDF before you upload. A missing certificate is a very common, very avoidable rejection. How do you actually submit? In the current cycle, most IGNOU projects go through the online project portal. You upload a single PDF of the whole project and get an on-screen confirmation, usually with an email. Some programs still route submission through the regional center, so confirm your exact MHHP-021 route before the deadline. Check the project portal and your regional center instruction, because this is one detail that genuinely varies. There is a small evaluation fee. For projects above 4 credits, and MHHP-021 is 6 credits, IGNOU charges a 500 rupee evaluation fee. Projects of 4 credits or less are 300. This has been the pattern since the January 2023 cycle. Always verify the current figure on the official upload page before you pay, because fee rules do get updated. Will there be a Viva? There may be. A Viva-Voce can be conducted by your regional center or the evaluator, mainly to confirm the work is genuinely yours. And here is the reassuring part. If you actually did the study, the Viva is just a conversation about your own work. The students who fear the Viva are usually the ones who did not do the project themselves. Do it yourself, and you will be fine. Here is what to expect, so nothing surprises you. Why did you choose this topic? What were your objectives? Why this method and this sample? What is your single most important finding? What are the limitations of your study? And what would you recommend to that hospital tomorrow morning? If you did the work yourself, every one of these answers already lives in your head. Just speak plainly. Almost there. Let us close the loop. How it is marked when results come, and the honest question of whether all this effort pays off. How is MHHP-021 evaluated? Unlike your theory courses, it has no separate assignment and no term-end exam. The evaluation is the report you submit, plus a Viva where one is required. And you must pass the project in its own right. Clearing your other courses is not enough. So treat the report as the whole exam, because that is exactly what it is. When does the result come? Project results follow the term-end examination cycle. If you submit between the 1st of December and the 31st of May, your result is declared with the June term-end results. If you submit between the 1st of June and the 30th of November, it comes with the December results. So submit early in a window if you want your results sooner. A late submission pushes you into the next cycle. And if it comes back, do not panic. If the evaluator asks for modifications or rejects the report for major gaps, you revise and resubmit in the next window. It delays your degree, usually by a session, but it is not the end. Read the feedback carefully, fix exactly what was flagged, and submit again. Most resubmissions clear once the specific issues are addressed. So, is it worth it? Yes. And for a very practical reason. Healthcare management is one of the few fields where a distance learning student can produce something an employer instantly understands. A real hospital study with your own data and your own recommendations reads like professional experience, not like coursework. When you sit in an interview, this project is the thing you talk about. And it is the reason you sound like someone who has done the work. Where does the MBA in Healthcare and Hospital Management commonly lead? Hospital administration and operations. Quality and accreditation roles. Health insurance and third-party administration. Medical records and health information units. Public health and program management. And healthcare consulting and process improvement. The degree opens the door. Your project is what you actually talk about once you are inside the room. Before we recap, the question students ask most. Quick, direct answers. Is MHHP-021 compulsory? Most. Yes. Every MBA in Healthcare and Hospital Management student must complete it to be awarded the degree. Which semester is it in? Semester 3 of the program? And confirm that against your current program guide since placement can be updated. How long should the report be? Commonly around 50 to 60 pages, roughly 18,000 words. As a general template, but confirm the exact MBA in Healthcare and Hospital Management figure with your guide. Do I need my synopsis approved first? Yes. Official written approval is required before you start the full report. There is no shortcut around that. Is MHHP-021 a medical project? No. It is a management study in a healthcare setting. Operations, quality, cost, patient experience. Can working professionals use their own hospital? Yes. With proper permission, ethical clearance, and no conflict of interest. In fact, your own workplace is often the easiest place to get real data. Let us recap in one screen. The code is MHHP-021, 6 credits, semester 3. It is a management study, not a clinical one. Approve the synopsis before you write. Use your own honest data and defend it calmly in the Viva. Do those 5 and MHHP-021 is very manageable. If you want to go deeper on one stage, this channel has focused guides. The MBAHCHM Synopsis Guide for writing the proposal that gets approved. The MBAHCHM Project Topics video for a full menu of healthcare management ideas. And the IGNOU Project Format Guide for the Universal Formatting Rulebook. This video stayed on MHHP-021 itself. Those go deep on the pieces around it. For full guides, formats and samples, visit ignouproject.com. For personal MHHP-021 project or synopsis help, message us on WhatsApp at +91 935 4637 830. And always verify current dates, fees, and submission rules on the IGNOU website. One last word, you can absolutely do this project. Do the work yourself, keep it honest, and MHHP-021 becomes the strongest line you have in an interview. If this helped, subscribe to Shri Chakradhar Education for the rest of this IGNOU series. This is BK Sani, guiding IGNOU students since 2010. All the best with your MHHP-021 project.